Hello and welcome to our IPAC Back to Basic Education series. Our series is meant to help those that are new to the world of IPAC, or infection prevention and control, and also be a refresher for those that may be feeling that they need one. In this module, we will be discussing point of care risk assessments, also known as PCRAs. Here is a view of each of the modules that are available within this series. If you haven't already, you can begin with our first module, IPAC Concepts, then move on to the other segments. In this module, we will discuss the importance of personal care risk assessments. All modules are under 30 minutes in length. You can also locate them on our website or use this QR code to bring you there. Make sure to take your time completing the module and feel free to pause when needed, as this is a pre-recorded session. By the end of this module, we hope that everyone will be able to identify the concepts, terminology, and application of routine and additional precautions and how these play an essential role in PCRAs, describe what a point of care risk assessment is, as well as the purpose and process, utilize the information and scenarios within this module to apply the use of PCRA within the guidance standards as applicable to your facility. Before we get into the nitty-gritty, it's important to know that PDAC's routine practices and additional precautions best practice document is the most essential resource when learning about the types of routine practices, additional precautions, and PPE, and when or how to utilize it within healthcare and congregate facilities. This is the base information that should be followed unless additional legislations are applied. So, for example, being current pandemic legislation and direction, you can use the QR code provided to access the document. Here are some excerpts from the most recent COVID-19 ministry guidance for congregate settings and healthcare workers. In these documents, you will find important information such as how to determine when masking is needed for source control or when additional protection is required, particularly important with the recent removal of universal masking in facilities and a greater emphasis on PCRAs, as well as clarification on what a PCRA or point of care risk assessment is, what role it plays in healthcare, and who needs to be completing them. Routine practices are based on the premise that all clients are potentially infectious, even when asymptomatic, and that the same safe standards of practice should be used routinely with all clients in order to prevent exposure to blood, body fluids, secretions, excretions, mucous membranes, non-intact skin or soiled items, and to also prevent the spread of microorganisms. Routine practices include hand hygiene and routine use of PPE, but can also extend to other elements such as a risk assessment that must be completed prior to any interaction with an individual, as well as environmental and administrative controls. The consistent and appropriate use of routine practices by all care providers with all client encounters will lessen microbial transmission in the congregate care setting and reduce the need for additional precautions. Routine practices are the infection prevention and control practices that must be used routinely during all activities with clients, patients, or residents to help prevent and control the spread of infectious agents. No matter what healthcare setting you work in, routine practices always apply. Some other examples of routine practices would be washing your hands if visibly soiled, or utilizing alcohol-based hand rub before and after glove use as per best practice. There is no risk assessment of either of these items. These are a must, no matter what type of facility you work in. These routine practices always apply. Now we'll take a look at additional precautions. Additional precautions are used in addition to routine practices for clients known or suspected to be infected with certain microorganisms. Additional precautions interrupt the known or suspected modes of transmission. Typically, additional precautions are added when a client is experiencing symptoms, for example, respiratory symptoms or gastric symptoms such as diarrhea, or they are diagnosed with a known infectious disease, such as MRSA or VRE, or the client has had an exposure to certain infectious agents, such as norovirus, influenza, or COVID-19. So as we discussed, while additional precautions built off of routine practices, they are specifically based on the suspected or confirmed agent's mode of transmission. So for example, airborne versus contact transmission. For some scenarios, additional precautions may also require specialized engineering controls or accommodation, such as private negative pressure rooms for patients with active tuberculosis. Proper signage is also necessary to indicate requirements and restrict any entry. Additional precautions will dictate PPE requirements, whether it's complete facial protection or fit-tested respirators, such as an N95 mask required. Additional precautions also indicate if dedicated equipment or enhanced cleaning protocols for the client's environment is required, like we would see with C. difficile, or whether the client may have limited transport or communication protocols. It's important to remember that all of this applies to both the client and the client's immediate environment. Specialized accommodations, signage, and PPE is based on the infectious disease mode of transmission, so the terminology you may be more used to hearing is contact precautions, droplet precautions, or airborne precautions. On the slide, you will see the PPE requirements based on their respective mode of transmission. It's important to note that no client is limited to one of these precautions, as they can be on a combination of precautions as well. Such as with COVID-19, the initial minimal requirement was droplet and contact precautions. These additional precautions became the minimal requirements, and any additional precautions based on a PCRA could be initiated. For an example, increased to contact airborne if an AGMP or aerosol generating procedure was being utilized. In some instances, specialized engineering controls may be required, such as an airborne isolation room for a patient with TB, or enhanced cleaning protocols for the client's environment, as mentioned on the previous slide. Let's pause and do a concept check on what we have discussed so far before we move on. Here we'll do a true or false question. The question is, all clients should be treated as if they are infectious, and therefore the same type of PPE would be used for all of them. True or false? Take a couple moments and read the question carefully. Okay, let's check out the answer. So the answer here is false, and we'll go over the explanation on the next slide. So the reason the answer to the question was false is because all clients should be treated as if they are infectious using standard or routine practices only. The same PPE would not be used at all times. Remember that routine practices are what are used during any and all activities with the client and their environment to help prevent the spread of infectious agents. For example, washing your hands or the use of alcohol-based hand rub. No matter what healthcare setting you work in, these routine practices always apply. Additional PPE can then be utilized based on a PCRA or risk assessment prior to that interaction in order to determine which PPE would be needed.
Breaking the links in the chain of transmission helps prevent the development of infection. But how do you protect yourself from infection? And what can your facility do to help protect you and the environment in which you work? The answer is to perform a risk assessment. A risk assessment is an evaluation of the interaction of the care provider, client, and the client's environment to assess and analyze the potential for exposure to an infectious disease. The purpose of a risk assessment is to identify risks and reduce potential exposure to infectious diseases and other health and safety hazards. There are two types of risk assessments. The first one is an organizational risk assessment and can be done by your employer to assess the need for certain controls or safeguards. For example, engineering controls include safeguards built into the care setting structure itself. This could include special ventilation within a room, dedicated hand washing sinks installed, cleaning processes for the environment, or installation of physical barriers. Administrative controls are safeguards introduced by the management of each care setting to continue to make the workplace safe, such as having clear and current policies for cleaning and healthcare provider education and training. Provision of the necessary personal protective equipment, or PPE, such as gloves, gowns, masks, and eye protection, is another important safety measure that must be provided by your employer through an organizational risk assessment. The second type of risk assessment is a point of care or personal risk assessment. Both terms are acceptable, however, we tend to use point of care. A PCRA is a thought process that each care provider must engage in before each and every client interaction or their environment. A risk assessment helps healthcare providers in choosing interventions which helps prevent the spread of infectious agents. So who performs these PCRAs? The answer is everyone. Anyone who interacts with clients or the client's environment needs to know about PCRA. This includes clinical staff, so an RPN, RN, or PSW, and non-clinical staff, so cleaning staff, dietary, support workers, recreational therapists, social workers, and many others. So we've discussed the two types of risk assessment, and we're going to focus on the second one, the one you, the staff, will do with your clients in your congregate setting. So when you perform a PCRA, so you're going to perform one before any interaction with the client. That is before you physically interact with the client. This would include, and not limited to, before providing them direct care, feeding them a meal, or assisting them in toileting. The second one is before any interaction with their environment. This may include before entering the client's room, before cleaning the client's bathroom, before taking their bedding or laundry, or before performing using an AGMP in their room. It is necessary because other controls may be absent or do not completely eliminate the risk. To help learn more about a point of care risk assessment in the workplace, let's consider how risk assessments are done by each of us every day. For example, consider the decisions you make before crossing the street. Your mental checklist might include these questions. Is there a vehicle or bike coming? Is there a crosswalk? Do I have time to get across safely? Is it snowing or raining? Do I have children with me or elderly who may move slower? This is a risk assessment, and you may not even realize you are doing it because you have been trained to do so since you were a kid. Without this risk assessment, you can put yourself, the people you are with, or other people traveling on bikes or in vehicles at risk. In our congregate care settings, you need to use our risk assessment questions in the same way to help guide your actions as you work to protect yourself and others. So just as with the mental checklist used when crossing the street, you will utilize a checklist for your PCRA. This PCRA assessment is ongoing throughout your workday, and the more you do it, the more comfortable with asking yourself the traditional PCRA questions you will be. You will form an automatic checklist that you will do and redo with each healthcare interaction you have with the client and their environment. They have reduced PCRA into three main questions you should focus on. The first one is the task. So what task are you about to do with the client? Are you helping them with toileting? Are you sitting and helping with a puzzle or game? Are you providing direct medical care, such as changing a dressing or doing a physical assessment? With this task, is there any risk of exposure? So my task is to assist with toileting. Will I have any exposure to bodily fluids? Next is the physical and cognitive status of the client. You have determined a task that is assisting a client with toileting. Now we look at the client. Am I able to verbally direct them, or do I need to physically assist them with the task? What equipment will I require to assist them? This may create a new task and new risk of exposure. The last question is around the controls in the environment and administrative controls that may be in place for your protection. Is there a grab bar for the client to assist themselves in toileting? Is there a sink that is accessible to them? Is there a policy or procedure, such as a care plan in place for this client that I must follow? Now we're going to take a look at each one with a little more depth, starting with the task at hand. So consider the tasks you are about to perform. Do I have the equipment I need to do this task? If the answer is no, gather the supplies and equipment needed before starting the task. Will I be touching blood, body fluids, secretions, excretions, or other potentially infectious material? If you answer yes, you want to wear gloves if the task involves contact with those examples listed, and clean your hands. You also want to consider additional PPE. Will my face potentially be exposed to a cough or spray of saliva or blood? If so, wear facial protection if the task exposes you to it. Will my clothing or skin potentially be exposed to splashes or sprays? If yes, wear a gown if the task exposes you to those. And the final questions you want to ask are, how skilled am I at this task? Can I safely perform this task myself, or do I need assistance? Ask someone to assist you if necessary. The next step in your personal risk assessment is to ask yourself questions about the status of the client. First, assess their cognitive or mental status. Will they be able to follow directions? You may need to change how you're going to provide the care for this client, depending on whether they can follow verbal cues. Are they cooperative? Remember to consider the extremes of age in your risk assessment, because they may not be able to understand what you are trying to do. Are they agitated or resistant? You may need to change how you're going to provide the care for this client. Now think about your client's physical status. Are they coughing, sneezing, vomiting, or having diarrhea? Do they have behavioral tendencies such as coughing, handling stool, or spitting? You want to wear gloves and a gown if you may be touching body fluids or excretions. You want to wear a gown if your clothing or arms may be soiled. And you would want to wear facial protection if your face may be exposed to anything that produces droplets. Example of that would be a cough or a sneeze. And the third one is the controls of the environment and administrative controls. So think about the controls that have already been put in place by your employer. Ask yourself questions about the administrative controls and controls of the environment that are in place in your own personal healthcare setting. Are there facilities for cleaning my hands? So you want to know where your facility's alcohol-based hand rub stations are and their hand washing sinks as well. Are there any policies and procedures for me to follow? So you want to know the infection prevention and control policies and procedures in your facility. Is there a special environment necessary for this client to contain transmission? You would want to assess the need and availability for this client to be in a single room, to be segregated from others, or to have single toileting facilities. So what is the layout of the space? Is there enough room to safely perform the task, or are adjustments required in order to perform the task safely? Will I be using a sharp item or potentially be exposed to a sharp? Be sure there is a sharps container within reach. Use safety engineered needles and medical sharps. Be aware of your facility's protocol for exposure management. In this way, you will determine what you need to protect yourself and the client, patient, or resident. All of these questions and answers are part of your personal risk assessment. So here is a summary of the last few slides compiled into 7 common questions to ask yourself when doing your point of care risk assessment. What are the patient's symptoms? What actions do I need to take? What is the environment where I'll be performing this task? What task am I doing? How cooperative is the patient? What is my risk of exposure? And what is my skill level for this task? This is a good resource that can be adapted and put up in halls or in training binders to remind ourselves of these moments.
Now it's time to do a concept check. Let's test your knowledge. A point of care risk assessment requires you to ask yourself all of the following, except A, what is the cognitive and physical status of the client?
B, am I being audited? What time of day is it? C, what am I completing with the client? D, are there any policies or procedures I need to follow? Take a minute. And now it's time for a concept check. The point of care risk assessment requires you to ask yourself all of the following, except A, what is the cognitive and physical status of the client? B, am I being audited? What time of day is it? C, what am I completing with the client? D, are there any policies or procedures I need to follow? Make sure you read the question. It's the point of care risk assessment. You're going to ask yourself all the following, except. If you need more time, feel free to pause the slide. If not, we'll now continue to the answer. So the answer is B. That's the one that is false. A, C, and D are the questions you do want to ask during a PCRA.
You may say that is a lot of questions to remember, or how can I apply all of this? There are resources that can help. Public Health Ontario, or PHO, has tool algorithms or flowcharts to assist in point-of-care risk assessments. Both are excellent tools and are in poster form, so they can be posted in areas where one may need to complete a PCRA. For example, perhaps in the hallway where the client's rooms are located. This first one is from Appendix B of the PIDAC Best Practices document we spoke to at the beginning of the module. So these flowcharts utilize the three main ideas that we've been looking through throughout this module: the task, the client, and the environment. The second flowchart we want to show you is from the Routines Practices Risk Assessment Algorithm from the Appendix B. This also can be utilized for any client interactions and has a focus on PPE control. Both flowcharts are excellent tools that should be utilized.
For the last portion of this module, we'll be doing some scenarios that may be familiar within your congregate settings. Each one will have a short video and scenario, and we will want you to think about what your point of care risk assessment indicates. Remember to keep the three questions in mind: the task, the client, and their environment. We will give you some time to pause to think about your answer before moving on to the scenario answers. So scenario 1, your client has not shown up for their scheduled dinner. You knock on the door and you see the following from a distance. You do need to perform a wellness check. So what does your point of care risk assessment now indicate? Remember those elements: the task, the client, and the environment. Now is a good time to pause if you want a little bit of time to think about it. If not, we will continue to the next slide. So we have organized some questions and thoughts one may have when performing their point of care risk assessment and organize those into those three main categories. Let's start with the task. Your task is a wellness check. You notice from the door the client is not well. Does your policies or procedures require you to take a temperature, or are you able to complete your task from a distance? Next, you want to consider the status of the client. We can visually see the client is unwell and experiencing respiratory symptoms. Respiratory symptoms without a diagnosis traditionally require droplet contact precautions for any close interaction with the client or their environment. However, your task is a wellness check at this time. So is your client able to communicate effectively with you while experiencing blah, 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 blah? So we have organized some questions and thoughts you may have while performing your point of care risk assessment and organized them into three main categories. There's no right or wrong answer here, just a discussion we want to have that would be your PCRA. So let's look at the first one, the task. Your task is a wellness check. So you know your client is unwell, but do your policies and procedures require you to do anything further, like take a temperature or come in close contact with the client? Or are you able to complete your wellness check from a distance? These are some things you would need to know to complete this part. Next is the status of the client. We can visually see the client is unwell and experiencing respiratory symptoms. Respiratory symptoms without a diagnosis traditionally require droplet and contact precautions if you're having any close interaction with your client or the client's environment. With your task being a wellness check, perhaps your client's able to communicate effectively with you from a distance. Maybe your status of your client is they're unable to communicate with you, so you are going to have to interact with them and their environment. So these are the types of things you're going to have to think about when you're doing a PCRA. The third is the environment. So if you're responding and completing the wellness check from the door, there are no environmental controls you really need to consider. But if that wellness check requires you to get a temperature or do a further assessment with the client, having that close contact with them or entering the room, then you have to consider that environment you're going into. So other parts of your point of care risk assessment have already noted that you would need PPE if you're entering that environment. So is that PPE available? Do you need to get a PPE cart? Is there access to hand hygiene? Will you need a thermometer? Will you need disinfecting wipes? So these are some of the questions you're going to be asking yourself before you continue on. Scenario 2. You're assessing a well client with an activity. What does your PCRA indicate? If you'd like a little bit more time to think about it, please pause now. If not, we'll continue through. So we broke it down again to those 3 categories. So the task, it's an activity, and by the video, it appears to be assisting in art. There is direct skin contact with the client and the contact with the client's environment as well. So the next question we must ask is about that client. So the status of the client. Is that client feeling well? Yes, in this scenario, it noted the client is well. There is no open wounds on the client is not experiencing any symptoms. But does this client have any behaviorals that you should be prepared for? Do they spit? Do they have sneezing or coughing fits? If they do, you may want to consider PPE being required. The last one is the environment. Being well, no behavioral issues, no symptoms, no PPE is indicated, but you may need moments of hand hygiene. So is there a sink to wash your hands or alcohol-based hand rub available to you? Our third scenario, your unwell client uses a CPAP machine and needs to be waken up for morning routine. What does your PCRA indicate? The task, that's waking the client. Therefore, there'll be contact with the client and their environment. But how long is that task going to take? How long is that interaction going to be? Will you have to assist them with their CPAP machine? These are things you want to consider when you're doing your point of care risk assessment to determine if any PPE is required. The client, they are unwell with respiratory symptoms, as we are already aware of that from the scenario. We also know they use a CPAP machine, and a CPAP machine is an aerosolized generating medical procedure. This is be considered when you're thinking about PPE. The third one is the controls of the environment. So the environment would include the CPAP machine, and there would likely be signage indicating the use of the machine with the clients experiencing undiagnosed respiratory symptoms. Due to the AGMP and potential for prolonged contact, staff should consider the use of an N95 with droplet contact precautions in this scenario. The fourth scenario, you need to clean a bathroom of a client who has been ill. What does your PCRA indicate? Please pause now if you need a few more minutes to think about it. If not, we'll continue to the answer slide. The task, well, that's cleaning and disinfecting the bathroom. You're going to have contact with chemicals and solutions, and you may have contact with splashes or sprays of bodily fluids or excretions. So you have to think, would any of this require any PPE? The second one is the client. The client is assigned to the bathroom, so are they well or unwell? From the next scenario, it has been stated that they're unwell. So that's how the client relates back to this task. The environment. Is there any signage on the door indicating additional precautions? Any precautions used for direct care always must be used for the environment interaction as well. So this scenario states the client was unwell and the task indicated likely had splashes or sprays that could occur to soil clothing. Signage should indicate if there's any additional information. Likely you would need full PPE to continue with this task. The last scenario, your client is experiencing emesis and you need to assist them. What does your PCRA indicate? If you need a moment, feel free to pause. If not, we'll continue on. The task. So how will you be assisting the client? What tools do you need prior to entering the room? Do you need an extra person to be available to assist you? Will you be exposed to splashes or sprays of infectious material from this task? Well, likely if you're assisting them and they're actively ill with vomiting, then yes, you do have the potential to be exposed to splashes or sprays. Once you're in there and assisting them, are you going to be able to come and go? Are all the tools you need within that room? That's when having an extra person could come in handy to get you any resources that you may need. So when you're considering the status of the client, we know they're symptomatic. How severe are the symptoms? This may require you to rethink your tasks and the amount of time the interaction may have. Are they able to contain it or are they not? Is it aggressive? Is it not? Do they have behaviorals with this or not? Lastly, consider your environment. Is there PPE in areas I can safely don and off? Is there access to hand hygiene? Is there signage or someone I can delegate to put up signage for any further interactions with this environment? With this situation, contact precautions at minimal are required. Depending on the extent of the illness and the depth of the task, droplet precautions should be considered or highly recommended. Okay. So to recap our presentation on point-of-care risk assessments, the objectives were for you to now be able to identify the concepts of routine practices and additional precautions and apply them within your settings. Understand the purpose, steps, and process of a PCRA. Confidently apply the use of PCRA within your congregate facility. Your professional expertise, the information given in this module, and the resources provided and linked for you should ensure you are successful with all these objectives. If by any means you feel you need more assistance, please do not hesitate to reach out to us at IPAC Hub and we can discuss additional educational support. You have now completed Module 3, Point of Care Risk Assessments. Please scan the QR code on the screen to view the other series modules. You may also visit our IPAC page, which is found on the www.tbdhu.com. Congratulations, you have now completed Module 3, Point of Care Risk Assessments. We are so glad to have been able to share this education module with you. Thank you all for participating, and always, if you have any questions or comments, you can reach us at our email.